My advocacy assignment, I decided to pursue burnout in occupational therapy. Healthcare provider burnout. Burnout is described by the World Health Organization as a state of psychological exhaustion experienced by individuals in jobs where they maintain long-term relationships with others and are exposed to prolonged fatigue, hostility, and discouragement. Study by Shin et al. Stated that healthcare providers who experience a high level of burnout tend to exhibit lower empathy and responsivity to client needs, which is part of the foundations of occupational therapy. Some statistics and some evidence. Over 60% of healthcare providers report burnout symptoms, with occupational therapists frequently citing unmanageable workloads and productivity pressures as primary drivers. The average educational debt for OTs is between $80,000 to $120,000, yet the reimbursement rates continue to decline, with Medicare cuts at 3.36% this year. Burnout is linked to 7 to 10% increase in patient safety incidences and medical errors, further demonstrating the need for systemic reform. Also, studies show that lower empathy and reduced responsiveness caused by burnout significantly impacts patient satisfaction and outcomes, which is a troubling trend that jeopardizes the very foundation of patient-centered care. The cost for the education of OT between $120,000 to $150,000 was reported in 2021 and 2023. But in comparison to other services, for instance, massage therapists, their certification can typically cost between $5,000 and $10,000, and personal training certifications that can range from $500 to $2,000. But then when you compare the cost of services, a typical massage session could cost around $60 to $120 per hour. Personal training that can range from $40 to $200 per hour. But meanwhile, the Medicare reimbursement for outpatient OT services remains between $100 and $120 per session. So, working in an acute care hospital during the pandemic, I was a witness to shortages of personal protective equipment, um, overwhelming emotional toll just going through the global pandemic. But yet, with all these factors, the productivity requirements for occupational therapists remained unchanged and led to disciplinary actions which were measured entirely unrelated to the quality of care delivered. So, with the impact of COVID-19, that led to burnout, leading many therapists to leave their positions, longer work hours, and pressure to cover weekend shifts, with therapists skipping breaks, documenting during meal times and outside of work just to keep up with the caseloads. Time with clients were limited, and the higher rate of patients returning to the hospital was happening shortly after discharge because you just didn't have the amount of time necessary to assess if they were safe to discharge home. The need for change is to reevaluate Medicare reimbursement rates for therapy services to ensure they adequately reflect the complexity of care provided and the inflation rates. Establish a loan forgiveness program for occupational therapists and other healthcare providers, especially those who are serving in underserved areas and servicing clients who are recipients of government-funded programs like Medicare and Medicaid. Also, mandate mental health resources and workload management programs within healthcare organizations to battle this type of burnout and support provider well-being. The consequences of inaction could be if nothing changes, we we risk losing many healthcare workers due to burnout. When staff members quit or leave because of stress, it costs healthcare facilities more money. And this also means fewer healthcare workers are available, making it harder for patients to get the care that they need. And as a result, quality of care can suffer. So, what can we do as OTs? We can advocate for policy changes, collaborate with professional organizations to lobby for higher Medicare reimbursement rates, support initiatives for loan forgiveness programs, and promote workplace well-being, encourage mental health resources, develop realistic productivity standards that prioritize quality over quantity of care. Educate stakeholders by raising awareness among policymakers, administrators, and patients about the value of OT, and share data and personal stories to humanize the challenges of burnout. Empower ourselves and colleagues to take small steps to protect personal well being, mindfulness, work life balance, and boundaries. Mentor new therapists to navigate the financial challenges, provide resources for professional growth, and strengthen the community to join advocacy efforts like letter writing campaigns or attending town halls, foster a culture of mutual support within the profession to reduce isolation and promote resilience. And here are the references. Thank you for listening.